prostate cancer affects a significant proportion of males globally, resulting in millions of deaths each year. While most patients present with localized disease, some develop disease recurrence involving areas outside the prostate or prostate bed. When this involves 5 or fewer areas, it is called oligorecurrent prostate cancer. These can involve nearby lymph nodes or areas outside the pelvis. It is known that if disease has recurred in a few areas, ablating all the known sites of disease may delay progression. For prostate cancer, this metastasis-directed therapy is called stereotactic body radiation therapy, SBRT. Ultimately, however, many patients may need additional hormonal therapy following SBRT. Hence, intensifying therapy in men with oligorecurrent prostate cancer during SBRT may improve cure rates and the interval during which they are free from progression. To this end, Dr. Amar Kishan, Dr. Jeremy Calais, and their team from the UCLA Health Johnson Comprehensive Cancer Center are running a clinical trial to evaluate the efficacy of a combined therapy including SBRT and a novel radioactive drug called lutetium-177 which has a high affinity for prostate-specific membrane antigen, PSMA. PSMA is present at the surface of prostate cancer cells. Lutetium-177 therapy is a targeted radioactive drug that can home to the PSMA-expressing cells to deliver the radiation emitted by lutetium-177, thereby inducing cell death. This type of drug has been shown to prolong life in men with widely metastatic, hormone-resistant prostate cancer. In theory, it would be well suited as an addition to SBRT, as it may treat disease that is microscopic and thus unidentified during SBRT. The trial, called LUNAR, or lutetium-177 PSMA neoadjuvant to ablative radiotherapy for oligorecurrent prostate cancer, will enroll 100 patients with oligorecurrent prostate cancer, who will be divided into 2 groups to receive SBRT alone or in conjunction with lutetium-177 PSMA. Patients in the experimental arm will receive 2 cycles of neoadjuvant lutetium-177 PSMA 6 to 8 weeks apart, followed by a PSMA-based positron emission tomography computed tomography scan in 4 to 6 weeks, and dose-adapted SBRT 1 to 2 weeks later, versus only SBRT in the control arm. All participants will be assessed for progression-free survival, disease burden, physician-scored toxicity, patient-reported quality of life, and androgen deprivation therapy-free survival. Enrollment for the trial commenced in September 2022 and will continue for the next 5 years through follow-up sessions. If successful, this therapy could eradicate the microscopic disease, reduce the need for subsequent hormonal therapy, and ensure a better quality of life for patients with oligorecurrent prostate cancer.